Good day everyone, I'm Zarah Gabriel, student nurse from Nueva Ecija University of Science and Technology. This video is about providing tracheostomy care to the client. Tracheostomy care keeps the area clean and dry, preventing infection and irritation. The purpose of this procedure is to maintain airway patency, to maintain cleanliness, and prevent infection at the tracheostomy site, to promote comfort, and to facilitate healing and prevent skin excoriation around the tracheostomy incision. The goal of this procedure is that the patient exhibits a tracheostomy tube and site free from drainage, secretions, and skin irritation or breakdown. For the equipments that we are going to use, check for bedside table, towel, 4x4-inch gauze pad, sterile tracheostomy dressing, pre-cut and sewn, surgical dressing, sterile cotton tip applicators, sterile basin, small brush, roll of twill tape, tracheostomy ties or tracheostomy holder, scissor, pulse oximeter, stethoscope, clean gloves, mask, goggles or face shield, hydrogen peroxide, and plain NSS or sterile water. For the implementation, bring necessary equipment to the bedside stand or overbed table, and then perform hand hygiene and put on PPE if indicated, such as mask or goggles. Identify the patient using the identifiers such as door tag, bed tag, wrist tag, or by just simply asking the patient. Close the curtains around the bed or close the door to the room. This is to provide for client's privacy. Determine the need for tracheostomy care. Tracheostomy care is usually done 2 to 3 times per day. Explain what you are going to do and what is the reason to the patient even if the patient does not appear to be alert. Good day, ma'am. I'm Zarah Gabriel and I will be your student nurse for today. Can you please tell me your name? Okay. So, Mrs. Bear, today I will be providing a procedure which is tracheostomy care. So, tracheostomy care is done to prevent infection and to maintain airway patency. Will that be okay with you, ma'am? Okay. Adjust the bed to comfortable working position, usually elbow height of the caregiver. Lower side rail, closest to you. If the patient is conscious, place her in semifowler's position. If the patient is unconscious, place her in lateral facing you. Move the overbed table close to your work area and raise the waist height if possible. Check for the lung sound to determine if there is wheezing or gurgling sound that may indicate the need for suctioning. Place the towel below the trachea site, covering the neck and the chest of the client. Put on mask, face shield or goggles, and suction tracheostomy if necessary. Prepare the basin and cleaning solutions. Mix sterile water and plain NSS and hydrogen peroxide 50-50 ratio. Be sure that it will be filled 0.5 inch of the basin. And on the other basin, plain NSS that will fill at least half of the basin. And then perform gloving. And then, remove the oxygen source if one is present. Stabilize outer cannula and face plate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand and gently remove the inner cannula and place it in the first basin with plain NSS and hydrogen peroxide solution and let it submerge for a few minutes. So I'm going to take off the inner cannula. Deep breath. 1, 2, 3. Simultaneously, gently slide the tracheopad or dressing downward and discard. And then check for exudate or drainage, skin breakdown, skin irritation, and inflammation. Then clean the inner cannula using the trachea tube, using the prepared plain NSS and hydrogen peroxide, and use the brush to remove the solidified or sticky mucus. And then check if there are still mucus left. Then rinse it in the second basin. Discard gloves and put on another set of gloves if necessary. Then dry the inner cannula using sterile gauze pad. And then, gently reinsert the tracheostomy tube back to its original place. Be sure that it is properly locked. And then dip cotton applicator or gauze sponge in a cup of basin with sterile saline and clean stoma under the face plate. Use each applicator or sponge only once, moving from the stoma side outward. Then pat skin dry using 4x4 sterile gauze. Then put on the pre-prepared tracheostomy dressing. Then check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Then reapply oxygen source if necessary. Remove gloves and assist the client in comfortable position. Raise bed rail and place the bed rail in the lowest position. Remove PPE if used and perform hand hygiene, then document. Position the client's comfortable position. Reassess the respiratory status, including the respiratory rate, effort, oxygen saturation, and lung sounds. Then remove all the equipment used.